You may not have considered hypnosis as an adjunct to chemotherapy. It's granted it's not the most obvious leap of thinking, but there's two areas in which hypnosis is very, very helpful in your situation. One is simply for the accumulated stress that you're experiencing. There'll be stresses around your situation, your illness, your therapy, situation around family perhaps. Perhaps you get activated when you go to the doctor, you get activated when you go into the hospital. When somebody comes in to plug you into chemo or to give you the tablets. There's all these points where stress can occur. And hypnosis is a wonderful therapy, really a frontline therapy for reducing that kind of stress, setting you up so that you can manage those situations without the stress. The second aspect where hypnosis is perfect for chemotherapy is in reducing the effects of nausea. And in part it works by reducing that stress, because as you become less stressed, you then will be less likely to feel nauseous, because quite a lot of nausea is a kind of expectation nausea. So many people, you may be in an environment where there are a lot of people getting chemotherapy. There's this expectation, people may be speaking about it, how terrible it is, it always makes them sick, and it becomes something of a self-fulfilling prophecy. But you can reduce this down. If you were to do a search on scholarly articles, you'll find over 70 studies showing the effectiveness of hypnosis to reduce the effect of nausea. Now, it could do it a little, or it could do it a lot. I've mentioned in other videos, in my dad's experience, 14 weeks in hospital with leukemia, that with the hypnosis we were doing, he was able to eat most meals across that time to the point of boredom, when he knew exactly what meal was coming on a Wednesday evening, and he knew the menu back to front. But you don't have to suffer, that's the main point. And there's a really important byproduct of all of this. If you can eat while having chemotherapy, keep it down, you can then absorb those nutrients. And you need those nutrients. You need everything working for you. The chemo is helping you in one respect, but you need the nutrition to help you in other respects. This is Daisy. Daisy always joins me in my videos. So I always recommend, find a dog to pat if you're feeling stressed. This time with chemo is very difficult for you and many people around you. But find those things in life that give you small amounts of pleasure. Whether it's just, if you're in a hospital room, looking out the window at the horizon, at the sky, or even going outside and seeing the trees. I remember one of the first times I walked out with my dad, and just sitting in the gardens of the hospital, he just enjoyed it so much. And I always ensured that he had a room that overlooked trees, because the stats show simply looking at trees as opposed to looking at the next building produces more, better outcomes for people. So many things. And these are just little things. So find ways to help yourself. But if you choose, hypnosis can help you a lot. And you will also learn how to use hypnosis in those moments when you're just there. You're there in that hospital room. When you're taking that medication, perhaps you're by yourself, perhaps there's nurses around or someone supervising, but it's up to you to take control of that situation, and you can learn to do that very effectively. So thank you, I'm Ian Newton, this is Daisy. We wish you all the very, very best. You can go to my site, iannewton.com, for more information, and you can look below in the description. Thank you.